the importance of muscle health, namely muscle mass, muscle strength, and function, that need to be emphasized across the continuum of care. So we need to know the impact of reduced muscle health on the lives of older adults. Okay, so this is an evidence, a local evidence in Malaysia. Strength and mobility of older adults living in urban, rural, and felda settlements in Malaysia. And for the findings based on the muscle strength, shows that Malaysians, regardless of setting, are at risk of sarcopenia. And if you were to compare the settings, it shows that those living in the rural and felda settlements are worse than those living in the urban setting. So recommendations number 2, muscle health should be prioritized in older adults, those 65 years old and above, with conditions who may be at risk of sarcopenia. So older adults that had been diagnosed with certain illnesses need to be given priority. And as a physiotherapist, we should be aware and observant on some of the red flags that will tell you it is urgent for you to measure or to screen for sarcopenia. Recommendations number 3, in most settings, okay, screening for possible probable sarcopenia or muscle impairment can be performed using the SARC-F questionnaire, followed by the assessment for low muscle strength via the hand grip strength or the 5 times sit-to-stand test with a cut-off of equal or greater than 10 seconds as surrogate measure of muscle strength. Okay, so this is an activity for you. You can try this to detect self-reported sarcopenia. Okay, if you are doing tele-rehabilitations with your clients, you can check their possibility of having sarcopenia by doing this finger ring test, also known as UB Waka test, which was designed by Japanese researcher. Okay, so what do? Is you use your index fingers and thumbs of both hands to encircle the thickest part of the non-dominant calf. Okay, so we'll discuss about the findings, okay, later, right? Okay, so this table shows that depending on your setting, you must choose the most practical tools for screening for sarcopenia. For instance, for example, if you are in the community setting or outpatients department, you can use hand grip. If you don't have hand grip, the anemometer, then you can use the 5 times sit-to-stand test. For measuring muscle mass, you can use DIA or calf circumference. So you want to increase the accuracy of the SARC-F, you can combine SARC-Calf. Okay, combine the measure of the SARC-F questionnaire with calf circumference. Okay, so I cannot show you. Okay, let's go back to what is SARC-Calf. Okay, so here, the combined value of SARC-Calf questionnaire components and calf circumference. Scoring for calf circumference, you are given 0 in the absence of low muscle mass. But if there is presence of low muscle mass, then you are given 10 score. So this is need to be added to the score for SARC-Calf questionnaire. So a total score of SARC-Calf more than 11, you may be having sarcopenia. All right, so getting back to this table, recommended tools for assessment of muscle health with cut-off values for the Singapore population. So Singapore, they also suggested the cut-off values for their populations to refer to, but actually they adopted most of the cut-off values from the AWGS. Alright, so recommendations number 4, diagnosis of impact of confirmed sarcopenia should be based on low muscle strength, low muscle mass. Okay, so that is confirmed sarcopenia. To know whether you are having severe sarcopenia, you have to measure physical performance. And if your physical performance is low, you have low muscle strength and you have low muscle mass, you are confirmed severe sarcopenia. Right? So recommendations number 5, if your setting do not have advanced technology, you can use BIA. And if you don't have BIA, you can use the calf circumference as a surrogate measure of muscle mass in your patient. Right? So recommendations number 6, okay, physical performance can be measured using the user gait speed or by using the 5 times chest stand test with a cutoff of equal or more than 12 seconds as a surrogate measure of physical gait speed of 1 meter per second. Right? Okay. Right. So we finished with the screening for muscle health. Now we are moving to the interventions. Okay. So the recommendations number 7. This suggested that progressive resistant or weight-based training is effective for improving muscle mass, muscle strength, and physical performance. All right. So what Singapore was suggesting, resistant exercise training at least 3 months significantly improved based on findings from systematic review. At least 3 months significantly improve muscle mass, muscle strength, and gait speed in older adults. So the higher the volume, okay, how do you measure volume? You multiply the total repetitions and the external load in kilogram is actually associated with greater improvement in lean body mass. So you go by these rules of thumb, okay, start with low to moderate, moderate to high, then high intensity. Okay, but strong recommendation for resistant exercise training is to do moderate or greater intensity muscle strengthening exercise at least 2 days a week or more. Okay, so you can, they suggested to use the box scale, which is simple, easier, rather than the one repetition maximum to rate the level of exertion during the exercise, or how heavy is the load of the weight or the exercise. So also to incorporate or integrate task-specific functional training. And remember that in the exercise training, it has to be specific to the needs of the older client. The overload is increasing the intensity from time to time. Okay, progress, keep on progressing. Okay, so this table was suggested by Singapore. Okay, for 12 weeks, allow the first 2 weeks for familiarizations. You need to know whether why you need to familiarize, because the older adult who never started resistance training, they need to adapt to the form of the movement. Okay, so right, so this you can refer later to the paper. Okay, so exercise prescriptions. Okay, when designing exercise, we always go by the principles of exercise prescription. So now we are referring to resistance training. But please remember, because here we are only talking about sarcopenia. Typical frail older persons, they present with other problems. For example, like they have poor balance performance, they have poor exercise tolerance. So you need to consider multi-component exercises. So for resistance training, you need to incorporate in the routine of the exercises, because the frequency, a minimum of 2 times a week. Then consider the intensity, the durations of the exercises, number of sets, the number of repetitions, the volume, progressions, variations. You may need modifications for all the people with some limitation. Okay, so not to worry, I will give this notes later to the organizer, and you can read the notes, and if you're not sure, you can always come back to me, refer to me. Okay, again, principles of strength training. there are principles of strength training, there are principles of balance training, principles of aerobic training that you need to be knowledgeable about in order to deliver safe and effective exercise to your client.